me now is Dr. Peter Chin-Hong. He's a professor of medicine and an infectious disease specialist at the University of California, San Francisco. Always great to see you, doctor.
Hi, Elaine. Thank you for having me on.
Well, let's talk about Shanghai's progress since lifting the lockdowns. Obviously, we saw that iconic restaurant close in Hong Kong, but Shanghai's been open now for a few days. What have we learned from China's zero COVID strategy?
Well, we've learned that there's some good things, there's some bad things. I think we've focused on the negatives, which include, kids not being in school, feelings of loneliness. But on the other hand, China hasn't seen a lot of hospitalizations, hasn't seen a lot of deaths. But I think a lot of people are worried that the strategy can't go on for so long, given a very, very highly transmissible variant that we're seeing.
Well, we have seen a resurgence of some cases in Beijing linked to that bar, 300 cases. Can we expect to continue seeing these kind of outbreaks every few days? Where do you say China is, especially in the capital city when it comes to COVID clusters?
Well, you notice, Elaine, that this cluster of 300 happened just 1 week after reopening in China, in Beijing, after they were locked down for a month. So I think it's going to be very, very difficult. And the reason why it's difficult is that people can go around with asymptomatic infection. So I know they focused on 2 people necessarily in that bar that might have been positive. But in my own experience with the Omicron variants, probably 1 in 20 people in my city of San Francisco have absolutely no symptoms, but they are infected. And that's what we know from hospital data. So I think it's going to be very, very hard. And the other aspect, of course, is that with this particular variant, it starts off in the throat and then goes to the nose. So China doing PCR is good in being more sensitive, but it may also, I think it is very onerous for people to line up an hour to get a PCR test on the other hand. So I think, again, good and bad with this strategy.
I want to get your take on some progress made with Chinese-made mRNA vaccines. There's been a report with some progress. So what would that mean for the COVID fighting arsenal in China? And what would it mean for the existing vaccines that China already has? Would this replace those?
No, it wouldn't replace them, Elaine, but it will give a very good alternative for mix and match strategy. When you mix and match different vaccine types, you expose the immune system to a wider repertoire, different views of the spike protein, and then you could be more robust. So I think having an mRNA, which can be quicker, could be more nimble in terms of creating versions that are variant specific, can be used in that method. Also, I think just on an elementary level, more Chinese need to get at least 1 booster. Right now we have 60% of those over 60 boosted at least once. And I think having more vaccines like these mRNA vaccines can help in that regard, because we know at least 1 booster will keep deaths and keep serious disease lower, particularly in that elderly population.
Right, great point there. It's always been that population that needs to be vaccinated at a higher rate. I want to get your take on where China and really the rest of the world, where it stands right now in this pandemic. Here in this side of the world, we're entering the summer travel season. And here in the U.S. and many other Western countries, travel restrictions are being lifted as we speak. So where does that put the world? And what do you anticipate to see in the coming months into the fall?
So I think what we're seeing, Elaine, is we probably will have a lull in July and August in the United States, possibly in the world. I think the big question is what BA4 and BA5, the kind of new variants on the block, would do. We already seen what it did in South Africa and in Portugal. We're seeing a little bit of activity in the Midwest of the U.S. Whether or not it will march around the world, including China, remains to be seen. And the thing about BA4 and BA5 is it can cause reinfections. But I think overall we would probably see a lull. Then back in the fall and the winter in countries in the north that have winter in the later part of the year, we will see a resurgence of either a new variant or flavor of Omicron, and together with influenza and some of the other viruses that will come back again with a vengeance, likely.
All right, always great to get your take. Dr. Peter Chin-Hong in San Francisco, thanks for joining us.
Thanks so much, Elaine.